This is Royal Manchester Children's Hospital. It's the biggest and busiest hospital for children in the country. Coming up, 7-year-old Hannah needs an urgent operation, but the risks are high.
I just feel sick, but you know she's got to go through it to get out the other side.
Could 11-year-old Alexander's bruised hip be something more serious?
I think it'd be wise to do an X-ray for your hips.
And the hospital's play specialists help 9-year-old Siobhan come to terms with her treatment.
What do you think the biggest worry is?
The needle.
Today, we meet a little girl who's about to face major surgery. 7-year-old Hannah Brock has been a regular patient at the Children's Hospital for the past 5 years.
Do you want to sit on my knee or are you going to sit there by yourself?
You're going to squash Daddy?
Sit on my knee.
I met Hannah back in 2006 when she was just 2.5, and I describe her as the most happy, bubbly little blonde bombshell I've ever met, really.
What do you want to be when you grow up?
I want to be a nurse when I grow up.
Fantastic. What kind of nurse? You can have nurses look after children, nurses that look
A nurse look after children.
Hannah has a rare genetic condition called MPS 6 and it's threatening her life.
Right, ready?
The hospital is the UK's centre for MPS 6, but staff here have only ever seen
You cut your hair,
37
then.
patients with the condition.
There's an enzyme missing, so the waste products don't get broken down appropriately, so her cells will swell up and eventually become dysfunctional, and particularly it affects the skeleton.
Do you have a look, see if it's stopped bleeding now?
Hannah's been having weekly
just put a little
enzyme
plaster on it
replacement
for you.
therapy at home, but it's not been sufficient to strengthen the bones or ligaments in her neck. Today, together with her parents, she's preparing for a major operation on her spine. Hannah's consultant, Richard Cowie, is one of the hospital's leading brain surgeons. He's semi-retired and only operates on extreme and delicate cases like Hannah's.
We are anxious to undertake surgery before any critical damage to the spinal cord occurs. If damage happens, then potentially she could become paralysed, wheelchair-bound, or even die.
But the decision to go ahead with this risky operation has not been easy.
We could damage the spinal cord and paralyse the patient. Sometimes the bone graft doesn't fuse. Sometimes the blood vessels that supply the spinal cord can suffer damage. And we do occasionally see major problems, but fortunately they've been very rare.
It sounds horrific, but if we don't do it, the consequences aren't there thinking about, and I'd rather have Hannah here a lot longer than if we didn't do it. In some ways I feel that it's very hard and selfish for her to put her through this, but if she doesn't, then we don't know how long we got her for.
It gives me just a little bit of worry. Just...
Because you don't know how it's going to be, do you?
And I don't know how we're going to have to work it through.
It's going to be all right, isn't it?
Yeah.
Tomorrow, Hannah faces an operation that could save her life. It's a rainy day in Manchester and the hospital's A&E department is busy dealing with the victims of today's wet weather. 11-year-old Alexander is one of them.
I slipped and fell on my back and all of my left side. It hurt down into my hip.
I heard some of the other children telling me that, or shouting at one another saying, Alexander's fallen and he's unconscious on the floor. But I was quite pleased to see that he was awake, but he was shivering and obviously in a lot of pain.
Alexander's complained of hip pain before, and his mum Julie's worried he's suffering from something more serious.
I had thought that maybe it was an injury from before, but he plays a lot of football and complains about it sometimes after football.
But Alexander's main concern is missing tomorrow's big match.
I want to play football tomorrow, especially because I got new football boots and I want to try them out.
In charge of the department today is Dr. Catherine Potier. She specialised in children's emergency medicine for the past 9 years.
Hey, how are you?
Good. Okay, sort of.
Alexander's unusually tall for his age, and Dr. Potier is keen to examine him in order to rule out a serious condition that can affect children as their bones develop.
I think it'd be wise to do an X-ray of your hips. Just make sure that there's nothing wrong with them. Okay. Sometimes children have a condition called a slipped upper femoral epiphysis. In children who are growing quite quickly, or some children who are very tall, the growth plate at the top of the hip bone can slip suddenly, and that can give them pain in the hip and difficulties walking. Some children it doesn't happen so suddenly and it can be more of a subtle thing. So it's very important to do an X-ray in these children.
The X-rays are back in minutes.
See, this was the gap, so that's where the bone's still growing. And this area here is the epiphysis that can slip.
Slipped upper femoral epiphysis is one of the UK's most common adolescent hip disorders. Fingers crossed Alexander hasn't got it.
Hi, Alexander. You okay?
Yeah, good.
Good. Right, so you've had your X-ray. I've just had a good look at it. Your pelvis and your hip bones both look entirely normal.
It's a relief.
Nothing's moved.
Yeah.
Okay. And the actual bones themselves look normal.
Okay.
So I think you're going to be able to go home, okay? And I'll try and get moving a bit on it, okay? Within reason.
It's good news. All Alexander's suffering from is a badly bruised hip. But now for the bad news.
I wouldn't go running and playing football.
Just looking forward to that.
Okay. Nice to meet you. All right, see you soon. Thank you.
I'm pleased that it wasn't serious and everything is okay.
It stops me worrying that there is something untoward. And I don't have to get up early to go to football tomorrow, which is the best bit.
I'm gonna sulk. I'm gonna sulk for 3 days.
Given the all clear, Alexander's free to go home, but he won't be pulling on his new footy boots this weekend. This morning, 7-year-old Hannah Brock is having surgery that could save her from life in a wheelchair or worse.
Get it done and get out the other side and make all this all better. Yeah?
Hannah has a rare genetic condition that means her spinal cord is being crushed by the weight of her head. Performing her operation today is consultant neurosurgeon Richard Cowie.
We know from studies of children who have this condition that it's progressive and that upwards of 50% or more will succumb to the damage to the spinal cord if nothing is done.
Once Hannah's spinal cords are protected, she'll need a special piece of equipment to help the bones fuse together, called a halo.
This teddy's called Halo because it's got a paper halo around it. And it's got the jacket to the halo that I'm going to have on. There'll be like little screws that's going to touch my head and we have to give them a wash.
Hannah's is an extremely delicate operation. On average, Mr. Cowie only performs it 6 or 7 times a year.
Surgery itself clearly has risks that we could damage the spinal cord, or that the spinal cord could suffer because of pressure or other difficulties.
Can you say bye to Jane? See you in a bit. Bye.
And there's a risk of paralysis. There's even a risk that the child could die. That risk is small, but it's not zero.
Don't worry about it.
I'm only going to hold your glasses like I'm going to wash them, okay?
Knowing the risks makes Mum Lucy's farewell even more difficult.
Look after. Thank you.
You just feel sick, you just feel useless.
everything's just out of your control, but you're also relieved because you know that she's got the best team around her and you know she's got to go through it to get out the other side.
Having been fitted with her halo, Hannah's operation can begin. It will be 3 long hours before Lucy finds out if it's been a success. Hospitals can be a scary place for kids, but here at the Royal Manchester Children's Hospital, a team of play specialists work hard to make sure children overcome their fears to help them cope with their treatment.
On the floor.
Frances and Helen have 50 years' experience between them as hospital play specialists. But today their skills are going to be put to the test with 9-year-old Siobhan Mulvey. Siobhan needs an injection to control a rare inflammatory condition she has called Behçet's disease. But she's terrified.
What do you think the biggest worry is?
The needle.
The needle. Right. Do you know what? It's normal to be worried. And what we have to do, we have to help our mind, because it's them who play tricks with us, don't they? They say, oh, it's going to hurt big, it's going to hurt really big. And we have to think about that, don't we? What we're going to do to focus our mind to say, I can do this.
You don't want to look, and we want to look at the fairy book, we can do.
We can make a journey.
We can make a journey, yeah, with fairies. OK, then that's what we'll do. I think a main fear is of the needle, and then a second fear was how would she react to the medicine, because she's had some bad reactions to medicines previously.
I'm scared of the needle.
Siobhan, we know you're scared, and that's OK, sweetheart, all right?
Siobhan may need these injections for many years to come.
I brought my chickens from Russia.
So Frances and Helen must help her willingly accept the medication.
I know you don't want to do it.
It's scary.
It scares you. And that's really normal to scare you. So what we need to do, I think we need to do them big breaths and practice the big breaths to perhaps blow Helen over. I want you to get a fringe to see her grey bit.
And as you let it out,
An hour of discussions later, Siobhan decides to give the injection a go.
Through the door, what will be there? Well done. What did you say?
Yay, we've done it!
Oh, well done. Oh, that's all fair to you. Yeah.
We'll all
It's very yourself.
Feel better.
Now she's had it. Yes, the next time will probably still be scary, but each time it will get a bit easier and we will find how she'll cope.
Siobhan Mulvey has earned this certificate for her first, what is it? Alimumab.
Wow,
injection.
I can't even say that. I have to call it you,
Says,
Mira.
congratulations from us all.
So if there was other children who had to come to hospital and they had to have injections like you've had to do, what would you tell them?
That it isn't as bad as you thought it was.
You've actually had your very, very first injection. And that is just so grown up. I think you've grown taller just sitting here.
It has all paid off in the end. You know, you go home with a nice feeling at the end of the day, thinking that you've helped make somebody's experience of hospital that little bit better than what it could have been. Come on then, let's go back.
Seven-year-old Hannah Brock's been in the experienced hands of neurosurgeon Richard Cowie for just over an hour.
OK, want to get into the back of the neck, so we'll get the fresh blade.
He's trying to free Hannah's spinal cord from pressure that's threatening to paralyse her. The delicate operation could take 3 hours. It's going to be an anxious wait for Mum Lucy. By carefully removing a portion of Hannah's spine, Mr. Cowie's released the pressure from her spinal cord.
If you watch very carefully, you can see it pulsate with the heart. We know now there's nothing physically trapping that anymore.
The pressure has been released, but removing the bone means Hannah's spine is now weak. To compensate, Mr. Cowie's taken some bone from Hannah's skull and will use this to support her neck and protect the spinal cord.
Good, fantastic.
The bones will eventually fuse to Hannah's spine, but to secure them now, Mr. Cowie uses a series of thin surgical wires.
The first of the bone grafts goes up the hole, and then if you can just slide it down. Okay, okay, close it, that's fine.
Mum Lucy's long wait is almost over.
Just can't wait to get the nod to say you can go down and see in recovery, so nearly there.
She's absolutely fine. There. Come and sit down. The surgery's gone exactly as I wanted it to do, and she's been very stable throughout, so it's just exactly as we planned. So I've got the pressure away from her spinal cord, and we've put the bone grafts in, and the position looks good, and she's exactly as we wanted to, yeah.
So it's like any other child should be.
That's what I'm hoping for. And we've got what appears to be a good position for the halo as well, so you can...
Hey, look at you! Hello, Prophet!
There's Mummy!
Hello! Oh, isn't this fun? Look at you! Hello. I'm going to have to kiss you like that, aren't I? Look, there's all your teddy bears. You're right. You look very beautiful.
Hannah's operation has gone well, but she'll face another tough test before finally being allowed to go home. Down in A&E, 2-year-old Mason's hurt his elbow after a major temper tantrum.
He's just not moving his arm at all. And can you move your arm?
No.
No.
Leading the shift today is Professor Simon Carley. He's had plenty of experience dealing with the fallout of many a toddler's tantrum.
We don't look very happy. Which is the poorly one?
This one.
Oh dear. And what happened?
Dad was taking him in from in the garden and he threw himself on the floor and Dad still had hold of his arm and we've heard a crack.
What was he like when it first happened?
Screamed in tears, in agony.
Okay. I think you might have something called a little pulled elbow. It's like a dislocation, really. The only real way to find out is to just examine it and just see what happens when we're examining it. It might squeak.
Yeah.
We'll have a quick look. Guys, can I have a quick look at your poorly arm?
Sure.
Let's have a quick look. Oh, he's actually... Oh, I'm sorry. Have a quick look at this. There we go.
In a
Fantastic.
split second, Professor Carley's worked his magic, popping the dislocated bone
Now, my
back
friend,
into place.
Mason, that's terrible when it goes back in, it hurts, but in about 10 minutes, I think your arm's going to be perfect. I do.
Is that gone back in?
Yeah.
Oh, right. He's done now.
Is that any better now?
Yeah, does it feel better?
Yeah.
High five. Yay!
Do I get a prize? So he's cured.
Thank you. Yeah.
Pulled elbows are just fantastic to do because you've got a family with loads of anxiety, child is in pain. All we have to do is just pop it back in, 3 seconds, you make it better. And that feels good.
It's been 3 days since Hannah's life-saving spine operation.
This could be a spotty roof.
A spotty roof.
Wow.
Okay.
To support her neck, Hannah's been fitted with a halo, which she'll wear for the next 4 months.
And we could get black felt tape and draw the windows on.
It'll take Hannah time to get used to it, but right now she's desperate to go home. Specialist physiotherapist Pauline Hensman has worked with Hannah since she was 2. It's her job today to get Hannah back on her feet.
On 3, Hannah. 1, 2, 3. Big push. Excellent. Good girl. You okay? Just slowly. Which leg shall we walk with first? That one. Good girl. Just nice and slowly, nice and slowly. Good girl. Well done. You okay? I think she's done amazing. I was just surprised we could let go. No stopping you.
Oh, superb. It's just like another step, another box ticked off and road to recovery. So, yeah, chuffed to bits.
Hannah's doing brilliantly. And just 2 days later, she's ready to face an even tougher challenge.
Put one foot on this step, right on the step, Hannah, a bit further on.
If she can pass this test, she'll be allowed to go home.
Right on, well done. Well done, okay.
Looking forward to going home, Hannah. Yeah.
I thought it was going to be a bit tricky, but I did it.
Hannah's recovered faster than anyone expected. 5 days after her operation, she's given the all clear and can go home.
Bye-bye.
See you.
Bye.